Thank you for your interest in the Tiger study, an NIHR-funded study led by the University of Bristol. This video will cover the background to the study, its design, and what involvement means for your centre. We are happy to follow this up by email or with a meeting to answer any questions you have at the end of it. Before we start, we should remind ourselves of the importance of good clinical practice, or GCP. GCP is an international and scientific quality standard for the design, conduct, monitoring, analyses and reporting of clinical trials. This trial is being conducted in accordance with GCP to ensure that research participants are not exposed to undue risk and that data generated from the research are valid and accurate. Eczema is common in children, and parents often ask their doctor whether a test might uncover a food allergy as a cause for the child's symptoms. If parents' concerns are not taken seriously, they may be reluctant to use prescribed creams, which they treat the symptoms and not the cause of the child's eczema. Specialists vary in their use of blood-specific IgE or skin prick tests, and there's a need for research to determine what role, if any, routine food allergy testing has in the management of childhood eczema. Tiger is a randomized controlled trial designed to answer the research question, does test-guided dietary advice improve disease control in children with eczema? 493 children with eczema were recruited from 84 GP surgeries across the west of England, Wessex, Thames Valley South Midlands and Greater Manchester CRN areas. The eligibility criteria are listed on this slide, the main ones being aged between 3 months and 2 years of age with at least mild eczema and no previous food allergy tests or diagnoses for the 4 study foods. Participants will be randomized to standard care or dietary advice based on the results of skin prick tests to the 4 study foods. The primary outcome is a patient-reported measure of eczema control called RECAP. A range of secondary outcomes include eczema symptoms, signs and quality of life. Parents also have the option of letting us collect a saliva sample for DNA analysis for genes associated with eczema and food allergy. Everyone is followed up for 9 months. In addition to the trial, there are nested process and health economic evaluations looking at the implementation and cost effectiveness of this intervention respectively. Participating GP surgeries will identify potentially eligible children. Interested parents will contact the research team who will receive consent, collect pre-baseline data and arrange the baseline visit. The baseline visit itself takes place at the GP surgeries. If participants are randomized to the intervention group, they will have skin prick tests to cow's milk, hen's eggs, wheat and soy, and will be given dietary advice according to the findings. The advice is determined by a dietary advice flowchart. For children for whom there is uncertainty about the safety of advising home ingestion of one or more of the foods, we will request an all food challenge to be done at your centre. We estimate 10% of children may need this, which equates to 1 participant per month per centre. All follow-up over 9 months is done by the research team, mostly by means of questionnaires, with a further face-to-face assessment, usually in the participants' homes at 24 weeks. Care of participants is otherwise unchanged, including referrals to secondary care if appropriate by their GP. Participants will be referred to you via a locally agreed route with the information listed in the All Food Challenge referral letter. Again, by a locally agreed process, the participant will be booked into an All Food Challenge appointment with you. We will send the child's parent a letter confirming when and where the appointment is, what food to bring with them, advice and appointment duration, a reminder to avoid antihistamines or relievers for asthma, and what to do if the child is unwell. At the appointment itself, the All Food Challenge study instructions should be followed. The outcome of the All Food Challenge must be recorded on the OFC Outcome CRF, preferably via an online link we will send you or if needed on paper. If you need to record any adverse events, this will be done on a separate paper adverse event CRF and returned to us by email. We're aiming to deliver oral food challenges within 2 weeks of referral. Because we are unable to predict when these will be needed, ideally research beds should be reserved and released on a rolling 2 to 4 weekly basis for other uses if they're not needed by Tiger participants. Payment follows activity as detailed on the research information sheet and this slide. In order to give your centre the green light, please complete your contract and delegation log as soon as possible. We also need a copy of the site PI's CV and GCP certificate. The trial is paperless otherwise, with all study paperwork, including the current version of the study protocol, accessible via the study website. Thank you for listening to this presentation. Please contact us by email with any questions or to arrange a follow-up meeting to get you started.